Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Mastectomy. Introduction. A mastectomy is surgery to remove one or both breasts. It is performed either to treat or to prevent breast cancer. There are several types of mastectomies. Which surgery you have depends on many factors. Many patients choose to have breast reconstruction after or during a mastectomy. Others wear a breast form called a prosthesis inside their bra. Some decide not to have reconstructive surgery or wear a prosthesis. This program will help you better understand the benefits and risks of the several types of mastectomies. It also describes what to expect before, during, and after the procedure. Breast cancer. Cancer begins in your cells, which are the building blocks of your body. Normally, your body forms new cells as you need them, replacing old cells that die. Sometimes this process goes wrong and a tumor forms. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. A benign tumor is a non-cancerous growth. They are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph channels and lymph nodes fight infection. They also drain excess fluid from the breast and arm. Breast cancer begins in the breast. Although healthcare providers can locate where the cancer started, the cause of cancer in a patient often cannot be identified. Alternative treatments. When a breast lump is determined to be cancerous, treatment includes one or a combination of the following: radiation therapy, chemotherapy, hormonal therapy, targeted therapy, immunotherapy, surgical treatment. The treatment recommended by a healthcare provider depends on the type of cancer as well as the age and condition of the patient. Your healthcare provider will help you determine the treatment suitable for you. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. Chemotherapy is a cancer treatment that uses drugs to kill cancer cells. It may be given in the bloodstream through an IV or taken by mouth. Hormone therapy is treatment that adds, blocks, or removes certain hormones. This can slow or stop the growth of some types of cancer. Some women with breast cancer may receive drugs that block the growth of cancer cells. This is called targeted therapy. Immunotherapy or biological therapy is another type of cancer treatment. Immunotherapy fights cancer by boosting your body's immune system. It may help your body kill cancer cells, slow down their growth, or prevent them from spreading. Most breast cancers are taken out surgically. There are two main types of surgery: a lumpectomy, a mastectomy. A lumpectomy is a breast-conserving surgery. It removes the cancerous breast tissue as well as some of the surrounding healthy breast tissue. It is usually followed by radiation therapy. A mastectomy is the removal of one or both breasts. A mastectomy to remove one breast is known as a unilateral mastectomy. A mastectomy to remove both breasts is known as a bilateral mastectomy. A mastectomy may also include removing lymph nodes in the armpit area to determine whether the cancer has spread. The extent of the operation depends on the size of the tumor and whether or not the lymph nodes in the armpit are involved.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Types of mastectomies. A mastectomy has two goals. One, To remove the whole tumor and all breast tissue from one or both breasts. 2. To check the lymph nodes in the armpit to make sure the tumor has not spread to them. Taking out a lot of lymph nodes from the armpit can cause the arm to swell. This is called lymphedema. But new techniques have been developed to take out only a few important lymph nodes in some cases. There are several types of mastectomies. These include modified radical mastectomy, total or simple mastectomy, skin-sparing mastectomy, nipple-sparing mastectomy. A modified radical mastectomy aims at removing the breast and most of the lymph nodes. A total or simple mastectomy aims at taking the whole breast out. This includes the breast tissue, skin, nipple, and areola. The areola is the ring of darkened skin around the nipple. A skin-sparing mastectomy leaves some breast skin in place to prepare for reconstruction. This type of surgery is immediately followed by breast reconstruction surgery. A nipple-sparing mastectomy removes breast tissue but not the skin, nipple, areola, or chest muscles. Even though the nipple is kept, feelings in the breast will change after surgery. Breast reconstruction is done right after removing the breast tissue. Sometimes a mastectomy may be done even if a woman does not have breast cancer. The surgery removes both breasts to reduce the risk of breast cancer. This is called a prophylactic, preventative, or risk-reducing mastectomy. It may only be done in women who have a very high risk of breast cancer. The mastectomy procedure. Several hours or the night before surgery, you may have an injection near the tumor. The injection will be a safe radioactive dye. In some cases, blue dye is given into the breast. The dye helps the surgeon know which lymph nodes to take out. A mastectomy is done under general anesthesia. You will not be awake during the surgery. Depending on which type of mastectomy surgery is done, 1 or 2 incisions are made. During the surgery, the surgeon is able to find the lymph nodes that have picked up the dye. The first lymph node to pick up the dye is known as the sentinel node. The lymph nodes that have picked up the dye are removed and sent to the lab for testing. Sometimes this part of the surgery is called a sentinel node biopsy. After the operation is complete, the skin is closed. A drain may be put in to drain excess fluid after the operation. This drain is taken out at some point after the surgery. Check with your healthcare provider about how long the drain is needed. A mastectomy without breast reconstruction usually takes 1 to 3 hours. A mastectomy with breast reconstruction can take an extra hour or 2. Risks and complications. This surgery is very safe, but there are several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider find complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, inability to urinate normally, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medicines. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. Sometimes the shortness of breath can happen without warning. It is extremely important to let your healthcare providers know if any of these symptoms happen. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Treating deep infections may require long-term antibiotics and possibly surgery. 2. Bleeding, either during or after the operation. This may require a blood transfusion or another operation. Fluid may collect under the skin, which is known as a seroma. This fluid may need to be taken out with a needle or another operation. A seroma could cause the incision to open up. 3. Skin scar. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. Nerves running through the axilla may be injured. This can cause shoulder weakness, loss of sensation, or arm pain, but it is rare for this to happen. When underarm lymph nodes are removed, the involved arm may swell. Occasionally, an elastic arm stocking or other methods might be needed to reduce the swelling. In patients who receive blue dye, there is a small chance of an allergic reaction. Some patients feel sad because of the diagnosis and because of the body changes. Even though this is normal, you should let your healthcare provider know about these feelings. After surgery. You may need to stay in the hospital for a few days after the procedure, depending on how you are feeling. Some women are able to go home the same day as the operation. After surgery, there will be a bandage covering the surgical area. You may feel some pain or numbness. Your underarm may feel like someone is pinching it. You will be prescribed pain medication. You will also learn how to care for yourself at home. You will learn how to perform specific activities and how to spot signs of infection in case one develops. You will be told when you can start wearing a bra again or wearing a breast prosthesis. If you are having breast reconstructive surgery at a later date, you may be referred to a plastic surgeon. Depending on the lab reports from the surgery as well as other tests, further treatment may be needed. This could include radiation therapy, chemotherapy, hormonal therapy. Make sure to contact your healthcare provider in case of any new symptoms such as fever, infection, severe pain, swelling, weakness, wound drainage.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A mastectomy is surgery to remove a breast. It is performed either to treat or to prevent breast cancer. There are several types of mastectomies. These include modified radical mastectomy, total or simple mastectomy, skin-sparing mastectomy, nipple-sparing mastectomy. Which surgery you have depends on many factors. For patients with breast cancer, a mastectomy has two goals: to remove the whole tumor and all breast tissue from one or both breasts, to check the lymph nodes in the armpit to make sure the tumor has not spread to them. Many patients choose to have breast reconstruction after or during a mastectomy. Others wear a breast form called a prosthesis inside their bra. Some decide not to have reconstructive surgery or wear a prosthesis. This surgery is very safe, but there are several possible risks and complications. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider find complications early. Thank you for using Explain.